Hello, Dental A Team listeners. This is Kiera Dent, and I just wanted to say thank you so much for being part of my Dental A Team family. I seriously love doing this podcast. I thought I was going to hate it, and I love it. I love it so much because I get to connect with you. I get to hear how this podcast is helping you and your practice be better. So if you have loved this podcast and you are willing to share, I would greatly appreciate if you'll share with your friends, if you'll leave us a review, if you'll give us 5 stars, anything you can do. Just like you guys grow your practices, we're trying to grow this podcast to positively impact the world of dental. This is how we get to grow our Dental A Team family. Thank you so much for listening. I hope you enjoy the show. Hey everyone, welcome to the Dental A Team podcast. We're your hosts, Kiera Dent
and Dr. Mark Costas.
Mark and I had this crazy idea that maybe we could combine a dentist and a team member's perspective because let's face it, dentistry can be a challenging profession with those two perspectives. And Dental A Team podcast was created.
I'm a practicing dentist, a multiple practice owner, a dental performance coach, and the founder of the Dental Success Institute.
I've been a dental assistant, treatment coordinator, scheduler, biller, office manager, current practice owner, and international dental consultant. Mark and I don't just understand you, we are you.
Our goal is to positively impact the world of dentistry by sharing our lessons learned from the road in hundreds of dental offices.
2 perspectives, 1 mission, to help dental professionals reach their full potential. Welcome to the Dental A Team podcast. Hello, Dental A Team listeners. This is Kiera Dent, and I am excited because you all know I am not a hygienist. So hygiene is that realm of, I don't really know. I know the general idea, but I don't know. I can't say that I've been in your shoes. I want to so badly. I've even looked into taking hygiene classes just so I can say, yes, I'm a hygienist. But instead, today, I decided to bring on a phenomenal hygienist. She's been in the field for several years. She's in the Philadelphia area, and she's an avid listener of the podcast and just a good friend. So I'm excited to bring on Laura Myers. Laura, how are you today?
Hey, Kiera, I'm spectacular. How are you?
So good. It's early morning podcast day. I love it. You are on the East Coast, so this is like mid-morning tea time for you. Or I don't know what you do on the East Coast around this time, but that's what I'm guessing. In my mind, it's like colonial and tea time, and that's what I just imagine because I've never lived there.
Around 10. Definitely snack time around 10. Absolutely.
Perfect. I like it. Good. Yeah, I just imagine like pull out the tea and crumpets, even though I've never lived on the East Coast, and I know this is really not true, but in my mind, that's what I want it to be. So, you know. So you have been a hygienist, but kind of tell the listeners a little bit about you so they can connect with your story. And you have quite the diversified background. So share a little bit about how you got into dentistry and your journey to being a hygienist.
Oh, well, thanks for that invite. I have been in the dental industry for probably over 25 years, and I've served in several different roles, just as you have as a front office administrator. I have been a dental assistant. I have been a practice manager, and that led me into more of the idea of then what more can I do? So I went to school to become a dental hygienist, and that was in my early 30s. So this is like my second career track, and from there I went back into practice as a clinician and have enjoyed the field tremendously. The growth and potential that we have in dentistry is really, really exciting.
That's so exciting. So guys, Laura has one-upped me, and I love it. I love people that are better than me, that I can just glean knowledge. And what you're saying, really, what I just gathered from that is, A, you're a rock star. You totally are not content with just, being status quo. It's, hey, I'm going to work through this, and then what's my next level? And also, B, I'm in my 30s, so I think maybe career path change. Like, let's just do this. Hygiene school, here I come, is really, if I'm following in your footsteps, I'm ready for it. But I don't know. I'm just totally teasing.
Kiera, with your busy schedule, I wish you multitudes of luck with doing that too. But if I could do it with 2 kids, you can do it too.
Hey, there we go. I don't know. It's constantly on my radar of, do I just do this or, but I love this. So let's dive into this. So what pushed you into hygiene? Why did you choose hygiene? Because this is always that piece. You were a dental assistant, you worked in the front office. And for me, my holdup has always been, oh, can I do the same routine day in, day out? Like, hi, I'm Kiera. Let me take your x-rays. Let me clean your teeth. And then I'm going to see you in 6 months. Like, could I do that rigid of a schedule? But I've talked to a lot of hygienists and they say, Kiera, it's different with every single one. So how did you take that leap from dental assistant, constant change, front office, constant change, to hygiene? And what kind of was your motivating reason for that?
Actually, I had a wonderful boss, and she was a superb educator. And she felt that the knowledge that I had gleaned over the years was more than just being, and I don't want to say just, but more than an office manager or practice manager.
Sure.
She felt that I had skills beyond that, and she was actually encouraging me to go to dental school. But again, kids, 30s, maybe not quite.
Sure.
But I truly enjoy educating. At that point, I was in pediatrics. I enjoyed educating the parents on, dental health. I enjoyed working with the children. So just to having then that ability to be hands-on and having that one-on-one time with your patient in the chair was just a great nugget and gold piece to search for.
I like it. And obviously, hygiene is heavily education based. I hear the debate back and forth. Kiera, do we cut hygiene down? Do we do assisted hygiene? Do we do 40-minute appointments? And I am a massive advocate for keeping that hour-long appointment with the hygienist, because I believe not only do you clean teeth, but you educate like nobody else in the office. You spend that hour with them. Your job is to educate, to make them feel safe, to treat them and to teach them so many pieces that I feel get lost in other areas, and you make up for it in hygiene. So I'm a huge advocate for keeping that 1 hour, for having the hygienist do the bulk of it. I know guys, there's totally 1,000 ways to do this, but my preference is that 1 hour because of exactly what you said, that education piece with your patients. So love your journey, Laura. Super excited to have you. So let's dive into hygiene, because you are wildly passionate about some certain pieces of hygiene. And I'm excited to give the hygienist some more nuggets on this podcast.
Okay, so since it's such a lacking piece today, how about could we talk a little bit about sleep and obstructive sleep apnea?
Oh my gosh, yes, please, because I am obsessed with sleep right now. So many people are coming into it. This medical billing, I'm working on building up a medical billing piece, and it's super fascinating to me because sleep it wasn't around when I was in the dental world before I left to go to consulting and working at the dental college. We weren't doing sleep in any of my practices. So I feel I'm like a smidge behind the boat. So I want to learn as much as I can, because it's that unicorn for me that I don't know. So yes, 100%. And hygienists, I think so many hygienists could help with this, but they don't, but it's new. So absolutely. Let's dive into this and share your nuggets, Laura. Teach me about sleep.
Oh, this is awesome. I love this. I could teach this all day long.
Perfect.
As a dental hygienist, we already are there. We're looking in the mouth. We've already, hopefully reviewed a medical history form and updated. Hopefully we've taken a blood pressure reading as well. So
yes, I agree. I agree. Do that, people. A lot of offices don't. Just do it.
Hey, that hour counts, people. Get that blood pressure reading in there.
Exactly. And guys, if you want a quick little nugget, a lot of hygienists struggle with time management. So I know you're thinking, hey, how do I add in sleep? Laura, you can even teach us that, because I've broken it down to 20, 15, so you have your whole 10 minutes. So it's broken up into that. And I personally put with hygienists this sleep part in that first 20 minutes of diagnostic pieces. But I want to hear you as a hygienist of how you do this. But yes, keep that blood pressure in there. Don't scrimp on that 1 minute, guys. It's totally fine. Just do it.
No skimping at all. So this is actually very, very implementable in your hygiene visit. Pardon me. Mm-hmm. What we're looking for in medical history, we're looking for several indicators of someone possibly having some issues, and they really do kind of point towards cardiovascular disease. So if on a medical history, you have somebody who has a history of having atrial fibrillation, they've had a heart attack, they've had a stroke, they have gastroesophageal reflux disease or GERD, or they have high blood pressure and they're on two or more. And they're on 3 medications to try to control their blood pressure, and it may not still be controlled. Those are little indicators that something could be more than just the heart itself. And then we do like to sometimes add questions onto our medical history forms that give us a little bit of just sleep feedback, such as, do you snore? Have you been diagnosed with sleep apnea in the past? If yes, are you currently being treated? So little questions like that. Somebody sleeps with an extra pillow at night because they need to be propped up, things like that. Those are medical history pieces that are very helpful for you to screen quickly to find out, okay, are these things I need to talk about?
I like that. And I like adjusting the medical history form. This is also the other debate in offices of, well, if they come in right on time and they're filling this thing out, then it cuts 10 minutes into my appointment. But I say, hygienists, pull them back. I give a 5-minute leeway. And if they're not done, pull them back. You can verbally ask these questions just to them, so you know your medical history before you start. And that way it doesn't take up your whole appointment because I can already hear the hygienist. I know you can too, Laura, of, well, if we add these questions, that's going to take into my hour. How is this ever going to work? This is how I recommend. But Laura, do you have other ideas? Because I love adding it to the medical history because that saves you time later on I feel like we're being sneaky, but not sneaky. We're just asking the right question to get the answers we're looking for in the most effective and efficient way.
And if you have some pushback, why patients are saying, well, why are you asking me this? Well, we may be your dental team, but we're also part of your healthcare team.
Right.
So little questions like this may help us have you have a healthier lifestyle by asking you questions about snoring. Well, maybe your partner doesn't enjoy your snoring, so is there something that we can do?
We're also helping with marriage and family, so don't worry about that.
Little counseling on the side, you never know.
I love it. And I do like how you phrase that of, we are a healthcare provider, and I think it's important to remember it's healthcare. And as you said that, I thought, truly, who better? I mean, yes, there are ENTs, ears, nose, throat doctors, but who is the second best that sees them on a regular basis? I can't tell you the last time I went to an ears, throat, and nose doctor, but I can tell you the last time I went to my dentist. And we work on the head. Like, we are working in the mouth, the airway, the breathing. Doctors spend 4 years studying the anatomy of the head, all of that. So who better to look for snoring and sleep than the person who studied this for 4 years and in the dental practice? I think it makes perfect total sense to me. And I think also when we look at ourselves and realize, when I go to my PCP, they're not looking at my airway. They're not looking for sleep. That's not something they're super proactive on. They're usually checking my blood pressure and my cholesterol and all those different things. I think it's all of us kind of have our toolboxes, and what's our go-to tool? What do we look for? What's a common thing? And I think in dentistry, starting to look for sleep and snoring is right in our wheelhouse of what we should be looking at.
Totally agree. You really want to create an experience for your patient, but also let them know you really care about their overall health and their quality of life as well.
Absolutely. Okay. So you sold me on, this is what we should do. These are a few little nuggets of how to fix it on the, and specific questions, guys. So put those on your medical histories. It's not hard to update the medical history. I know it looks like an insanity thing to update, but you can totally update it. Add a few quick questions to it. Chris Phelps does Cialdini principles, and he always says to pre-suade the patient. So if you're not into Cialdini or any of those things, get into it. It's very cool. But I think that these questions are pre-suading, basically like warming up the oven for the patient to even have thought about those questions. So it's already ready to go when they come to the hygiene room.
Excellent. Yes, absolutely. Pre-suading is huge in what we do because really we're prepping for our dentist to walk in the door as well. So if you already put those nuggets in there, you're already, preparing them. Hey, one step closer to being, taking care of your patient in a better way.
Absolutely. Okay. So patients in the room, what do you do?
Patients in the room. Okay. We went over medical history. Oh, now we're going to take that blood pressure. Okay. So people,
we're going back to blood pressure, guys.
just for a hot moment. So, people come in like, I'm so nervous. My blood pressure is always high here. Mm-hmm. And, and then my question is, when was the last time you had it checked at your doctor? Well, I only go when I'm sick. Okay. Yeah. Well, that's a problem. Mm-hmm. So blood pressure screenings are very important. You want to identify, the consistency of it. If you have a blood pressure that's in like 200 over the 90s, that's a little red warning that maybe you should have a little discussion with them. Have they had it addressed with their primary care physician? Obviously, we can't diagnose it, but we can certainly put a little inkling in there that they should probably see their physician for that. So,
and I am going to just chime in on this because I actually have a coaching client. She's one of my best friends. We've been coaching since January of this year. I do one-on-one calls with her every single week. And she just has massively grown, but it's super crazy because her husband is a dentist, and believe it or not, she would go in every time for her hygiene appointment and she had high blood pressure. She's like, oh, I'm just nervous. I'm just stressed. I've been running around the office. Because of her hygiene appointment, they looked back and every single one, she had high blood pressure. And finally, the hygienist said to her husband, who's the dentist, I really think we should check her blood pressure. It's been high every single time. Sure enough, she has high blood pressure problems. Her dad actually died of, I believe, it was like a heart attack or a stroke. And because of that, she is very, very high risk for it. But every single time she just brushed it off of, well, I'm just stressed being at the dentist. And it was not just being at the dentist. And her hygienist was the one who caught it and sent her there. And now she's on blood pressure medication. She's on doing yoga and Zen and trying to calm her life down. But I think we don't realize the severity. And I think more often than not, we could catch these things. Another office just diagnosed cancer on a patient when I was there last week on Friday in the hygiene operatory. I think it's important to remember that simple blood pressure check can really truly save lives. And I've seen it so many times that I'm just going to, I'm wildly passionate on this. Like, if you're not doing it, do it. Grab those blood pressure cuffs, just do it, because another person's life was saved from seeing the hygienist.
And you can be doing a lot of time management with this. It takes 2 to 3 minutes for the blood pressure cuff. If you use an auto cuff, let it do its thing. You can start your note for the day. You can be preparing your instruments. Be multitasking while this is happening instead of just sitting there staring at the pressure.
That also gets rid of the awkwardness.
Exactly. You're like staring at the person staring at you, and I'm like, no. Okay, I'm going to put this down, and so you can multitask during this time. It's okay.
Definitely, okay. I like it. Okay, perfect. So we did the blood pressure plug again.
We got there.
Everybody, that's your tip for the day. Do blood pressure. Okay, moving on.
Absolutely.
We didn't know.
All right. Alrighty. So then we look at the oral exam. We are all trained as dental hygienists and dentists to do a thorough oral exam, an oral cancer screening. We're looking at structures. You're looking at the mouth, for really, 60 to 70% of your time while you have that patient in the chair. So the things that we look for structurally in the mouth when we're doing this intraoral exam is you're looking at, talk about tongue. Let's talk about, is the tongue sitting high on the teeth? Does it cover the chewing surface of the tooth or the occlusal surface? Does that tongue have some scalloping on the sides like that of a clamshell? That's an indicator that the tongue could possibly be, again, too large for the mouth, or we call it macroglossia. Those are things that are indicators that there could be a problem with breathing at night. We also talk a little bit about I guess I should probably stop there with the tongue, but those are the pieces, those two pieces, the scalloping of the tongue and how high does the tongue sit in the mouth? Does it cover those occlusal surfaces? So
looking for those are for sleep. Is that correct? Because once again, I'm not a hygienist. So that's what you would be looking for sleep specifically to help out with that, correct?
Yes, that is correct. Those are the two pieces.
Okay.
So, and then we talk about tori. Oh my goodness. You have a patient who has the large bony structures under their tongue, those tori, and they could be kissing tori, and you can't even get an x-ray film in there. When you have large lower tori, which again, pushes the tongue up higher into the airspace. Those are indicators that you should be also thinking about and looking at. And also, even if there's a palatal torus there, the bump on the top of the roof of the mouth, we should be considering that. I mean, that's all impacting some of the airway space. The next thing we look at are, the teeth. Obviously, we're already looking at them. So we look at what we call attrition, or the flattened cusps. They could be someone who was a clencher or a grinder in the past. Do they have a history of reflux, of the problems with heartburn? And then we also, with the teeth, we consider what we call the loss of vertical dimension. They've worn their teeth down, that they have flattened cusps. And again, that impacts the amount of airspace that you have in the mouth.
Interesting.
And then it's really, the last thing that we also look at is we are always looking at our soft tissues. So when you are looking in there and you have someone say, so you can look at the back of the throat, you look to see, is the airway back there super narrow? Is it, you would think that, it's a big space back there. You remember the cartoons on, like the old Boomerang cartoons, and you would see the character be like yelling, and the uvula is hanging back there.
Yep, exactly.
And you think it's so big. Well, let me tell you, sometimes when you look in the airway, they're tiny. They're really tiny. I look for large tonsils if they're still there, especially with kids. And then even a uvula. The uvula, if it's elongated or enlarged, something's happening. When a uvula is elongated, it could be pulled down at night with snoring. So those are just some of the anatomical things that we look at.
Okay. So let's say I come in, I've got one or two of you talked about the tongue, you talked about the teeth, you talked about the uvula. Did I miss any? Those were the three.
Soft tissues. Tonsils, all that kind of good stuff.
Okay. Great. So we've looked at those four. So that's a quick checklist. And honestly, when you're getting into this, it might be nice to, pause the podcast, type this up, make a quick little checklist. You're going into this, you've been looking at this, but now you're looking with new eyes. And I love that. It's kind of, they say you've lived in a city for so many years, and then you bring a friend there and you see the city in totally new eyes. And that's what I feel you're kind of doing right now, is you've been looking at mouths for years and years. Now you're looking with new eyes, a new angle to look for these things to help with sleep apnea. So, all right, Laura, you've looked at these items. What do you do next? Let's say, how do you have the conversation of sleep apnea? Like, what do you do from here if you notice that they'd be a candidate for sleep apnea?
So if we haven't even talked about snoring or had it on our medical history, this is where I pause for a moment and I pull these pieces together and say, does somebody tell you at night that you snore? Have you ever, been told that you snore? That's usually my first question. And if they say, oh yeah, my wife, or they do the little eye roll thing,
that's an indicator.
You're like, okay, guilty as charged.
Exactly.
So that's one of the questions that I'll ask. Or, are you waking up in the morning feeling refreshed? That's another question I'll ask. Or I may ask, if you're falling asleep at inappropriate times, meaning you're in the car, stopped at a light, and you fall asleep, or you're in a movie theater, an exciting movie you wanted to see, and you fell asleep. You're in church, you fell asleep. Just inappropriate times when you should be paying attention to someone, or you're talking to someone and you've fallen asleep while you talk to them. Mm-hmm. Those are little indicators that there's some sleep deprivation, that is. Mm-hmm. So those are pieces that, will start my conversation with them. And then we go from there. Yes, I have been told. No, I haven't been told. And then I'll go over what my findings were to say, and it may be something that you want to talk to your physician about if you're experiencing some of these side effects of not sleeping well.
Mm-hmm. Mm-hmm. So these are the side effects of not sleeping well. So that's what you're going to tell them. So you're educating them as you're going through. Is that correct?
Correct. And I try not to get too far in depth, oh, your tongue is so big, you lay down at night. If you sleep on your back, it's going to cut off your airway. I mean, you can go into those pieces. It just, again, depends. You have to be time managing, and you need to direct the response from your patient as well. Are they responsive? Are they non-responsive? So you just have to drop those pieces to say, if they're responsive, then you're going to try to move them forward and talk about, you should consider getting a sleep study completed. It may not be a bad idea. You have a history of having, some heart disease. Oh, your father died of a stroke. Okay, well, these are little things you need to take into consideration so that we can make sure that we're promoting good health for you and you can have a quality of life.
Mm-hmm, mm-hmm. And so really it's basing on the patient. But I also feel it's one of those things where sometimes people have to take time to process. And just because they're not responding to you does not mean that they're not interested. You have to realize this is the first time they've maybe heard of it. They're not familiar with it. And I think sometimes people, hygienists, front office, treatment coordinators, you name it, when people are silent, we assume that it's rejection, that they don't want it, that obviously they hate us now because we just brought something up and now they're silent. We go to this extremity when the reality is it's not. And people sometimes just have to process. So I think it's important to educate. I was talking this morning on a marketing podcast of it takes people, it used to be 4 or 5 times that you'd have to contact somebody before they'd purchase a product. And now I've heard 14, I've heard 16, I've heard 20. It's a lot more touch points we're having to do. And so I think for your patient, you are a trusted educator. You have to remember that you're just not on the news. You're not on social media. You're actually telling them specific to their mouth that they might just need a little bit of time to process this in order to be on board and it might even be that they're embarrassed to ask what the next steps are. So I don't know how you do it, Laura, but from a patient standpoint of not being the hygienist, I would almost want, granted, this is me. I'm very bullet points. I like my information handed to me on bullet points of, okay, this is my problem. What do I need to do to solve it? Do you ever give them the solutions of what to do? Do you drop those nuggets of, hey, you might be a great candidate for sleep apnea. It's very simple. This is what we do. How does that kind of flow for you once you've talked to them about a solution for that?
Pardon me. So we do talk the pieces and parts. Once that little glimmer of, oh my goodness, I'm sorry.
You're okay.
Oh my goodness, this could be a problem for me. I think I'm starting to realize that I might be affected by sleep apnea. So we talk about the steps. We talk about, first of all, needing to get a diagnosis. And that has to come from the physician side. We in the dental world are not able to prescribe sleep studies, nor are we able to order them at this point in time. Now, proviso, if things have been changing with the American Academy of Dental Sleep Medicine and so forth, I'm sure things are probably progressing that at some point in time, I'm hoping that we can at least screen in the office for it. So just stepping back there again, getting the sleep study completed, and that takes some time. You get back to the primary care physician, they get their consultation, they were referred to a sleep physician, they have the sleep study. It takes a little bit of time. So talking them through that to get the diagnosis first, and then letting them know that there are different options available for treating sleep apnea should they be diagnosed. So we obviously want them to have the best gold standard for their type of care. And that it may be a CPAP machine is what they may need. And that's important that they get what they need. But knowing that some patients really don't want to have that snorkel stuff on their face all night long.
It's like Darth Vader. My in-laws have It's seriously like Darth Vader. I was like, whoa, you are a sight. Like that could be my future right there. It's totally fine if you have that. She really is an awesome person and she sleeps great now. So it's okay. But yes,
it's a good thing.
It is a good thing. I think, and she also got it when there weren't other options. And I don't know if she's ever even known that there were other options. It's an education piece that I know the dentist she's going to is not talking about it. So that could be an educating piece as well.
It's absolutely anybody they usually recommend mild to moderate sleep apnea, that oral appliance therapy can be the first line of treatment. Now, Again, we need to have enough teeth in some aspects, or talk about implant therapy so that we can use an oral appliance in their mouth if they don't have enough teeth. But that can be another show, another
I like
podcast.
it. Yes, we'll talk about that one next time, Laura. You're welcome back. It's going to be great.
I'm so grateful. Thank you.
Of course.
So we can talk about those aspects of what treatment looks like, and then give them the bullet points. Sleep study, then get your diagnosis, and then make a decision as to what type of treatment that you would like to pursue once you know what your diagnosis is. So those are some pretty simple pieces: PCP, sleep study, and then go for treatment. So it should be pretty uncomplicated as far as what are the next steps.
I like that, because keep it simple. I think sometimes something I do see in hygienists and dentists, I'm not just going to talk about, but we're talking primarily to the hygienist right now. So sometimes we like to overeducate. And I know people say, Kiera, there's really no way to overeducate. And I say I disagree. If you give too much information and it's not simple for them, where they could literally go tell their friend about it, I think we've made it too complicated, and that's when people don't say yes. If it's, hey, we're going to do a quick, simple sleep study, based on that, we'll probably send you to your primary care physician. And then from there are a couple different options, and we'll go over that. Hopefully we can do the least invasive, but at least we know the information, and then you can make an educated decision. That is so simple. Like, that is so easy. I think
it's great. That's the way it needs to be. If somebody came at me with 10 different things right now to say, okay, you need to go through all this, and I look at my life and go, I hope I can get to step one.
Exactly. That's all it is. And sleep study is really easy. They take it home with them that night. I wanted to try it, but they both got sent out to the patients that day when I was at the office. So I'll have to try another office. I want to try this. I want to know what it feels like, and what people go through, because I think going through it is also a good education piece as well. So if you have it in your office, maybe talk your doctor into letting you try it out. It's kind of like Invisalign. When you can try those trays out, you're much more likely to talk about it. A night guard, because you, just like on this podcast, what's our tagline is, we don't just understand you, we are you. So we can actually talk to you about the pieces that you deal with. So when you were saying it though, Laura, it made me think of, I feel, and tell me if I'm totally off base on this analogy, but I feel like it's kind of, with kids. I worked for a dentist, and we would do palatal arch expanders a lot of the time. Mm-hmm. And so in hopes of preventing braces or having less length of time in braces, I feel that the sleep appliances done in the office, when you said this is like a first step, hopefully it's the least invasive, it could be preventative. I thought immediately it kind of related to a palatal arch expander, where we're being proactive with it. We're looking for solutions for the patient, so we're not getting to the CPAP, or maybe they're already past that, and at least we know. But I don't know. Is that a decent analogy, or did I totally miss the boat on it?
No. I think if somebody doesn't know about it, and you're able to identify some pieces that could possibly be a problem, let's get in there and let's see if, hey, let's get the sleep study done and say, hey, well, maybe you don't need to go and have all the therapies done. Your alternative could be, let's talk about weight loss. Is it that you have too much weight on you, and the heaviness in your, around your neck, that could be causing some issues with your breathing at night. Many times people who are in the obese and morbidly obese category, when they lose weight, the sleep apnea tends to get better, or even go back to normal.
That's crazy.
So like you said, if we can be proactive and have to prevent the CPAP, we can prevent having to have an oral appliance in there. Let's go for it. Let's get it done.
Right. And I think for us in healthcare and in dentistry, I'm so big on the proactive and preventative approach. And that's what I feel the sleep study is. I was talking, you guys heard, if you haven't heard, go back and listen to Ryan Isaac. He's from the Dentist Money Show. He's awesome. He's a financial planner and advisor. And I think we chatted about it on our podcast. If not, when we were at our event we were in Idaho together, we went and did an event, and he talked about this study of these rocks and these snakes, and how it was a simulation, and the people would sit in there, and there were these rocks, and they would touch them. And when they'd flip over, if there was a snake under the rock, it would actually zap the person sitting there taking this study. And what they figured out is there was a pattern to these rocks. So people could tell certain rocks, they knew there would be a snake under there and it would zap them. And they said that the stress levels when they were watching it, when people knew that there'd be a snake under there, they were less stressed because they knew the bad outcome than they were on the rocks that they didn't know what was going to happen. And so I think that that's with patients with sleep apnea. A lot of times we want to avoid it. We don't want to know. But honestly, that creates a lot of stress and anxiety. It's better just to know the bad news if it's going to be bad news than it is to just sit in this denial period. And I think if you can help people see, hey, we're getting information, so then you can make an educated decision and we can be as proactive as possible and help you have the longest, healthiest life possible. That's what our job is to do.
Absolutely. It really is. I mean, the alternative of down the road having more cardiovascular issues or more complications with your diabetes. There are so many different systemic effects. Again, the most common one is the cardiovascular, but there are other issues. We may not be able to lose weight easily because we're not sleeping well at night. Our hormones aren't balancing. We may have diabetes and it's becoming more uncontrolled. So there's just so many things that we can help prevent down the road by just having this simple conversation.
I love it. I love it. And I love that you said it's a simple conversation. So, hygienist action items, I would say, based on what you said, Laura, and you gave so many insightful points, but one, fix those health histories. So that way we can start asking those questions. 2, start doing those oral exams a little bit differently. Look with different eyes, look for those different pieces, figure out what you should be looking for so you can help with that diagnosis. And obviously you heard I say help with it, we're not diagnosing. And then the third thing is have that simple conversation. I don't know if you remember, Laura, but the first time you had to start talking about perio or the first time you had to start talking about fluoride, like those are sometimes scary for hygienists to have those conversations. But once again, it's just a conversation. It's just education. And you're just doing your job as a healthcare professional to educate the patient on what they could need, different options out there for them. And I always think if I was that patient sitting in that chair, what would I hope that my hygienist would do? I would hope you would educate me on all the knowledge that you possibly have in a simple, concise way. So that way, because times change, education, different studies are coming out. We're constantly evolving and becoming better. I would hope that my hygienist, my healthcare professional was the state of the art, that you knew what was going on so you could educate me so I can make the best informed decisions. That's what I depend, and I say that very strongly, I depend on my hygienists, my doctors to be the best that they possibly can be. So that way I can be the healthiest and happiest long-term that I possibly can be.
So well said. I love it, Kiera. You are so great about talking about education and pieces and knowing that as providers, we're responsible to let someone know what we see. And, again, we're not diagnosing, but we're making observations and sharing our observations.
And guess what, guys? If you misdiagnose it, sweet. It's totally fine. People are so scared, but I would rather you tee it up for like worst case scenario than not even having the conversation at all. So it's like those rocks and those snakes. It's like, let them know. Don't do a scare tactic. That's not what we're going for, but the education. So thank you for that compliment, Laura. And thank you for the nuggets. That's so many pieces. Was there anything else out of that recap that I did of the med history, updating that, doing a different oral evaluation, and then having the simple conversation? Is there anything else that I missed that would be a good bullet point for people as a recap when starting to implement sleep apnea?
We didn't really talk about it, but make sure you make notes in your clinical notes to say that we did talk about this and what you observed, so that you already discussed it with them, and they come back in 6 months. You can say, hey, so how are you doing, and have that conversation maybe in a different direction though.
I like it. And we wrote a hygiene course. So in the Dental Success Hygiene, we wrote a course, and I remember one of the pieces that stood out to me because let's be real, I read this whole thing not knowing half of what you guys were talking about, but I read it and it said documentation. If you haven't documented it, it didn't happen.
It didn't happen.
And I love that. I love it so much. So, and Laura, I know you're starting to do some consulting in the Philly area. So you guys, Laura is a wealth of knowledge. I definitely want to get you back on. I think it's fun to educate hygienists from all different angles. And if you're in the Philadelphia area, check her out. She's fantastic. We'll definitely leave some information about her in the show notes so you guys can reach out to her. But she's phenomenal. And Laura, thank you so much for joining me today, for taking time out of your day and dropping some sleep apnea nuggets for those hygienists out there. And I think honestly, any person on the dental team, this is super helpful because we're a team and all of us can help each other out on it.
That's what it comes down to. Well, thank you so much for having me, Kiera. I look forward to, hopefully we can have a couple more conversations in the future and give your teams, give our teams, everybody's teams, a little bit more comfort level with talking about sleep.
Absolutely. Thank you again, Miss Laura Myers. Guys, this was Laura. Thank you also, as always, for listening, and I'll catch you next time on the Dental A-Team podcast. That wraps it up for another episode of the Dental A-Team podcast. Thank you so much for listening, and we'll talk to you next time.